Hey, future dental assistants. Welcome back to round 2 of the DANB practice test. If you haven't already taken the first test, go back and start there and then come back to this video. And if you've already taken that test and passed, I hope you're prepared because these questions are a little bit tougher. But before we get started, be sure to hit that like, subscribe, and notification bell so you are alerted every time I upload new study sessions. Let's get started.
Question 1. What is the purpose of etching enamel before composite placement? A. Removes debris. B. Creates mechanical retention. C. Whitens tooth. D. Kills bacteria. The answer is B. Creates mechanical retention. Acid etching creates microporosities in enamel for micromechanical retention of bonding agents. Question 2. Which nerve provides sensation to the maxillary teeth? A. Inferior alveolar nerve. B. Lingual nerve. C. Trigeminal nerve, maxillary division. D. Facial nerve. The answer is C. Trigeminal nerve, maxillary division. The maxillary division V2 of the trigeminal nerve innervates maxillary teeth. The mandibular division V3 innervates lower teeth. Question 3. What is the flash point minimum for a fire to occur? A. 100 degrees Fahrenheit. B. 200 degrees Fahrenheit. C. 300 degrees Fahrenheit. D. 400 degrees Fahrenheit. The answer is C. 300 degrees Fahrenheit. The fire triangle requires fuel, oxygen, and heat. Most dental materials have flash points around 300 degrees Fahrenheit or higher. Question 4. How should contaminated instruments be transported to the sterilization area? A. In open tray. B. In hands with gloves. C. In closed label container. D. Wrapped in paper towel. The answer is C. In closed labeled container. OSHA requires contaminated instruments to be transported in closed, leak-proof label containers to prevent exposure. Question 5. What is the working time for most zinc phosphate cements? A. 1 to 2 minutes. B. 3 to 5 minutes. C. 6 to 8 minutes. D. 10 to 12 minutes. The answer is B. 3 to 5 minutes. Zinc phosphate cement has a working time of 3 to 5 minutes. Mixing on a cool glass slab extends working time. Question 6. Which size film is used for adult bite wings? A. Size 0. B. Size 1. C. Size 2. D. Size 4. The answer is C. Size 2. Size 2 film is standard for adult bite wings and periapicals. Size 0 and 1 are for children. Size 4 is for occlusal. Question 7. What is the definition of asepsis? A. Cleaning instruments. B. Absence of pathogens. C. Sterilizing equipment. D. Using gloves. The answer is B. Absence of pathogens. Asepsis means the absence of disease-causing microorganisms. It's the goal of infection control procedures. Question 8. Which type of gypsum product is strongest? A. Type 1 impression plaster. B. Type 2 model plaster. C. Type 3 dental stone. D. Type 4 dye stone. The answer is D. Type 4 dye stone. Type 4 dye stone and Type 5 high strength stone are strongest. Type 4 is used for dyes requiring precision. Question 9. What should you do if a patient begins to have a seizure in the dental chair? A. Restrain the patient. B. Place something in their mouth. C. Protect from injury, turn on side. D. Immediately call 911. The answer is C. Protect from injury, turn on side. Protect the patient from injury, turn them on their side to maintain airway, time the seizure, and call for help if it lasts over 5 minutes. Question 10. Which angle classification describes a Class 2 malocclusion? A. Mandible is protruded forward. B. Mandible is retruded posteriorly. C. Teeth are perfectly aligned. D. Crossbite is present. The answer is B. Mandible is retruded posteriorly. Class 2 retrognatic means the mandible is positioned posteriorly relative to maxilla. Class 3 is prognatic, protruded. All right, y'all, score check time. Drop your scores in the comments. You want at least 7 to be on track. If you're below that, don't panic. We still got more questions coming. Let's keep going. Question 11. What is the ideal moisture content for dentin bonding? A. Completely dry. B. Slightly moist. C. Very wet. D. Doesn't matter. The answer is B. Slightly moist. Dentin should be slightly moist. Moist bonding technique for optional adhesion. Over drying collapses collagen fibers. Question 12. Which radiographic error causes overlapping of contacts? A. Cone cutting. B. Incorrect horizontal angulation. C. Incorrect vertical angulation. D. Movement. The answer is B. Incorrect horizontal angulation. Incorrect horizontal angulation causes overlapping interproximal contacts, making the radiograph non-diagnostic for caries detection. Question 13. What does the term incipient caries mean? A. Advanced decay. B. Root caries. C. Arrested decay. D. Beginning or early decay. The answer is D. Beginning or early decay. Incipient means beginning or early stage. Incipient caries appears as white spots and may be reversible with fluoride. Question 14. Which handpiece speed is typically used for cavity preparation? A. Low speed 10,000 RPM. B. Medium speed 100,000 RPM. C. High speed 400,000 plus RPM. D. Ultra speed 1 million RPM. The answer is C. High speed 400,000 plus RPM. High speed handpieces run at 400,000 plus RPM and are used for cutting tooth structure efficiently with water cooling. Question 15. What is the purpose of a base plate in denture construction? A. Final denture base. B. Record bite registration. C. Polish denture. D. Repair denture. The answer is B. Record bite registration. Base plates are temporary, rigid bases used with wax rims to record jaw relationships and establish vertical dimension. Question 16. Which of the following is a contraindication for nitrous oxide sedation? A. Anxiety. B. First trimester of pregnancy. C. Fear of needles. D. Gag reflex. The answer is B. First trimester of pregnancy. Nitrous oxide is contraindicated in first trimester pregnancy, COPD, recent eye surgery, and certain psychiatric conditions. Question 17. What is the primary purpose of calcium hydroxide liner? A. Thermal insulation. B. Stimulate secondary dentin formation. C. Strengthen restoration. D. Improve aesthetics. The answer is B. Stimulate secondary dentin formation. Calcium hydroxide promotes reparative secondary dentin formation in deep cavities and has antimicrobial properties. Question 18. Which statement about panoramic radiographs is false? A. Shows entire dentition. B. Lower radiation than FMX. C. Good for detecting interproximal caries. D. Useful for impacted teeth. The answer is C. Good for detecting interproximal caries. Panoramic radiographs are not good for detecting interproximal caries due to overlapping. Bite wings are needed for this. Question 19. What is the acceptable range for systolic blood pressure? A. 60 to 80 mmHg. B. 90 to 120 mmHg. C. 130 to 140 mmHg. D. 150 to 160 mmHg. The answer is B. 90 to 120 mmHg. Normal systolic is 90 to 120 mmHg. Pre-hypertension is 120 to 139. Stage 1 hypertension is 140 to 159. Stage 2 is 160 plus. Question 20. Which material is used for final impressions in crown and bridge procedures? A. Alginate. B. Polyvinyl siloxane or PVS. C. Zinc oxide eugenol. D. Compound. The answer is B. Polyvinyl siloxane or PVS. PVS addition silicone is the gold standard for final impressions due to accuracy, dimensional stability, and detail reproduction. All right, y'all, that wraps up round 2. Count your scores. 18 to 20, you're killing it. 15 to 20, you're on track. Anything below that, don't stress. This is practice. We keep building. 40 DANB questions down. Just a few more left for round 3. Go ahead and combine your round 1 score with your round 2 score and drop it in the comments. Is there a specific question that tripped you up? Let me know. And if you need more help, watch my full breakdown videos of each section. From the DANB exam overview, infection control, general chairside, radiation safety, and techniques, I got you covered. Also, be sure to check out my comprehensive DANB study guide. It covers all the key topics you need to know to pass so you're not guessing or stressing over what's on the exam. I'll link it in the description box. If you found this video helpful, hit that thumbs up and share with a dental bestie, and then subscribe, and I will see you both in the next video. Bye!